Are you confident structuring your OET roleplay? Watch this video where we show you how. Hello, I'm Jo from SLC, here to help you pass your OET exam. In today's video, we're going to look at providing structure from the clinical communication criteria for speaking. We will look at what this criterion actually means and how to improve in this area. Don't forget to check out our website. We've got the perfect preparation course for you. Let's get started. What does providing structure mean? To meet the requirements for this area, you need to show that you can structure the conversation logically, use clear signposting language to signal changes in topic, and use language to organise your explanations clearly. So how can you improve this area of your speaking? Let's look at organising the structure of your role play logically and purposefully. Here we have an example of a role play card. Take a moment and think about how you could structure this role play. As you can see, the tasks follow a logical sequence. By sticking to the order of the tasks, you would prioritise the importance of what needs to be done with the patient, as well as not offending the patient about advising them to keep sharp objects out of reach too early in the conversation. Using signposting can help make the interaction clear and purposeful. We'll take a look at this now. We use signposting phrases to help guide the listener as to what is coming up next. Let's take a look at some examples. Look at these two examples. Which one do you think is more effective?
Yes, that's right. It's not too deep and it should heal very well without stitches. So can I ask if you know how to change a dressing?
Well, sort of.
Yes, that's right. It's not too deep and it should heal very well without stitches. So I'd like to talk to you now about your son's dressings, but do you have any questions about what we've talked about so far?
No, I think that's all clear so far.
Great. Can I ask if you know how to apply a dressing?
Well, sort of. In the first example, we can see that there is no warning of a change of conversation, so the listener has to pay more attention to make sure they aren't missing any important information. In the second example, we can see clear signposting, how the listener is guided to what is happening next, and it also makes the conversation more purposeful. You should also use organisation techniques in your OET speaking. Chunk information together so it's easily understood by the listener. Have a look at these two examples.
Okay, so you'll need to clean the area and pat it dry, apply a thin layer of the antiseptic cream and apply the dressing and secure it. Do you think you can manage that? Okay, so first you'll need to clean the area and pat it dry, then apply a thin layer of the antiseptic cream, and finally you'll need to apply the dressing and secure it. Do you think you can manage that?
The information given in both of the examples is the same, but as we can see in the second example, by organising the explanation using linking phrases, it is much clearer and easier to follow for the listener. Now let's take a look at some useful phrases you can use for signposting and linking. To signpost a change in topic, to sequence, linkers of addition, cause and effect. Let's look at some things you can do to improve this area of your speaking. Plan where you will provide structure. In the preparation time that you have before starting the role play, you have time to think where you can use signposting effectively, organise your explanations and provide a logical interaction. Listen to signposting language used in example OET roleplays and see how it is used effectively. Practice explanations. By practicing this in preparation for your speaking exam, you will be confident in using organising techniques in explanations. It is also important to use signposting to help you direct the conversation where it needs to go while being respectful of the patient. Let's now take a look at some resources which are available to you which can help you improve providing structure in your OET roleplays. Here we have an example taken from the NHS website about the treatment of asthma. The language used here is patient-friendly and it gives you examples of clear and organised explanations. Read this extract and now think about how you would explain inhalers to a patient in an OET roleplay. Here's an example.
So you're going to be given an inhaler to help you manage your asthma. I'll explain and show you how to use it now, and this is what you'll need to use when you begin to feel symptoms. It should bring you relief within a few minutes. Okay? Your inhaler is for when you experience symptoms. If you find that you're using it 3 or more times a week, then you should tell your GP or asthma nurse. Alright?
Now take a look at this extract from the NHS website about what asthma is and its causes. Can you think of some signposting and linking phrases to complete the explanation on the screen? Here is an example.
Let me explain what asthma is. Asthma is a common condition of the lungs which can cause difficulties breathing. There's no cure, but there are some things we can do to help control the symptoms. Alright? So I'm going to explain the possible causes, okay? Asthma is caused by an inflammation of the airways, and there are many common triggers for these. One common trigger is allergies, or perhaps environmental factors such as smoke, pollution, or cold air. Another trigger could be exercise, or asthma might also be set off by colds or flu. Okay? So this means it's important to identify and then avoid your asthma triggers to keep the condition under control. Does that make sense?
In your self-study, have a go at looking up different conditions and practice explaining them. Top tips for providing structure. Look for opportunities in your preparation time to provide structure throughout the roleplay. Practice using signposting and linking phrases. The more you do it, the more naturally and automatically it will happen in the exam. Stick to the order of the tasks on the card. This will help you with the logical flow of the conversation. So thanks for watching. For more videos like this, don't forget to subscribe to our YouTube channel. Hit that bell so you're notified every time we post a new video. We've got loads of preparation courses, so check out our website, the link's below. And see you next week. Bye. In today's video, we're going to look at one of the clinical communication criteria. Hi, how? Sorry. Using signposting can also make the conversation. Let's take a look at some phrases you can use. Top tips for use your preparation time. No. Let's now take a look at some resources which are available to you.